better knowledge, this session will end. Now I am asking question to Dr. Basu. Dr. Basu, please.
May I request Dr. please.
Please mute audios. Please mute audios, please. Sir, as we all know that this is the new strain, and it is different from the before 1 year before strain. And I'm asking, sir, please, what are the new symptoms in this new strain? Please.
Most welcome to all participants. Thanks to Dr. Jayanta Dhar for moderating this session. And most welcome to all participants from the Bengal Academy of Applied Homeopathy. And good afternoon. The first question has been asked by Dr. Dhar. What is new strain symptom actually we are getting in our daily practice? We all know there are mostly 3 new strains we are getting. UK variant, and one is from Africa and one is from Brazil. That is actually not our concern. We are very much concerned about the symptom in new strain. Rather, the difference of symptom we are getting from the original strain when COVID-19 was started during last year. Now I am sharing a few slides for your better convenience, and you will get it. Just see and get it. Okay, I'm sharing. First symptom we are getting in almost all patients, though it was present during original phase, that is in initial phase, but still it is we are getting. There is unusual cough. Cough has been the main symptom of COVID-19, but a persistent cough with a different sound. If you once get the COVID-19 or COVID cough, personally, you will not forget it. I will make you understand with presentation also. Just get it, how the patient is coughing. The original audio recording from my patient. Just get it. This is a typical cough. One second, I am repeating. It's seems to smoker cough, but something different. Next symptom we are getting in new strain, that is the pink eye. Looks like conjunctivitis, but actually it is not conjunctivitis. And the study done in different countries, almost those who are fair complexion, we are getting pink eye. And redness, swelling in the eye become watery. And this pink eye or conjunctivitis like symptoms was not too much present or abundant during first phase or during the original phase of when the COVID started. Another symptom is breathlessness. We are getting both in original one and now new strain, breathlessness. The new symptom we are getting almost out of 10, 5 to 6 patients, they are complaining of stomach trouble. The pain in the stomach, crampy pain with nausea and vomiting. And sometimes some patient may complain of stool with mucus or watery stool or diarrhea-like stool, along with pain abdomen and crampy pain abdomen with nausea and vomiting tendency. The fatigue is very much characteristic in new strain. Even after recovering from an illness or viral infection, we know our body tends to take time to heal and people often get tired easily. But COVID recovered patients suffer from fatigue and exhaustion, but it can last for up to 6 months even. And the severity and duration of fatigue can help determine long COVID. The study says that around 63% of the patients have reported suffering from fatigue, weakness, and muscle pain. During last 2 months, whatever patient I have treated, COVID patient, most of the patient, whatever may be the complaint, they are complaining, cough, pain, abdomen, nausea, vomiting, stool mucus, whatever may be the complaint. The extraordinary symptom, what they are experiencing is the profound frustration and fatigue. Hardly they can move in their room to have a glass of water. Hardly they can talk in telephone. The extraordinary fatigue and frustration is one of the characteristic features we are getting during new strain. Another important symptom we are getting brain fag in COVID patient, especially some neurological symptoms we are getting, especially those who are at the recovery phase of the COVID, they may have brain fag. Another symptom we are getting heart palpitation. Heart palpitation with anxiety and high rise of temperature in selected patient, it is the main symptom, it is a characteristic symptom we are getting during new strain. Another thing we should keep in mind, that is a loss of taste and smell. Something, whenever any patient is complaining of loss of taste and smell, we are in a position to confirm, yes, you are suffering from COVID. But to diagnose a COVID patient to having a symptom like loss of taste and smell is not a confirmatory symptom. But most of the patient, they are complaining loss of taste and smell during illness. It may be after 3 to 4 days, even after 7 or 8 days, after 8 to 9 days. And patients, those who are suffering from this trouble, they may continue after illness also. The main difference from the new original strain and new strain is, in original strain, almost all cases, the development of the symptom was started with sneezing, coughing, pain, body ache, malaise and headache, then followed by loss of smell state, then followed by cough, breathlessness and oxygen saturation difficulty, all those things. But in new strain, a group of people within 24 to 48 hours getting infection, they become trouble, or the lung is being so much infected, it became ground glass appearance, total lung with a low oxygen saturation, they are compelled to be admitted in hospital. That is the main trouble we are getting in the new strain. Another important thing we are getting in new strain, the patient, those who are suffering from gastric trouble or gastrointestinal trouble in initial phase, they may not suffer from any fever. For 2 to 3 to 4 days, they feel that may I have some trouble or taking some irregular foods or night watching. All those may cause this trouble, and they ignore the symptom as they are not suffering from any fever or body ache. After 3 to 4 days, the fever comes, and after that, all symptoms one after another, they suffer. Even a group of patients those were started with gastric symptom, up to 3 to 4 days, it may abate it selected spontaneously. But on 5 days onwards, cough starts, and within 7 to 8 days, the pneumonia, typical COVID pneumonia takes place. It is the main thing. It is the main thing that causing trouble in new strain the patient we are getting. Now I am just eliciting all the symptoms of a new strain along with old strain. Most common symptom we are getting, first thing, fever, dry cough and tiredness. Out of 10, about 6 or 7 patients will complain with fever, dry cough and tiredness. Less common symptom, aching pain all over the body, sore throat, diarrhea, conjunctivitis, headache, loss of taste and smell, sometimes rash on the skin and discoloration in the toes. Serious symptoms. Always we should keep in mind, if any patient is complaining of difficulty breathing or shortness of breath, a sense of oppression in the chest and the bed, chest pain or pressure, feeling. Another important symptom we are getting, loss of speech or movement. Patient hardly talk over telephone. Within 20 to 30 seconds after communicating, they hardly continue their speech. If we get any of one symptom in any COVID patient, it is very serious and we should take consideration. Okay. Now you may go for another question if you have.
Okay, sir. Thank you. Sir, another very common question is, it is very difficult to differentiate from common cold and COVID symptoms. At the beginning, the common cold symptoms and COVID symptoms are almost same. If you can tell us something.
In this regard, I would like to share one thing to all of you, all the homeopathic fraternity. Don't confuse with common cold and COVID phenomena or COVID symptoms. Whenever any epidemic disease is going on, any one or two symptom, epidemic-like symptom, if we get, we should not ignore that symptom, and we should not ignore that patient is not suffering from COVID, he is suffering from common cold. One thing we should keep in mind, anyone, if suffering from sneezing, guttering, he or she may not suffer from COVID. But whenever symptoms start, we should advise that patient to keep him isolated. He or she may not suffer from COVID, but he or she suffer from common cold. It will cause no trouble for him to be isolated for 4 to 5 days with common cold. So now, during the pandemic situation, we are not in a position to differentiate common cold and COVID symptom. A patient, whenever complaining of common cold-like symptom, flu-like symptom, or influenza-like symptom, we should consider every patient may suffer from COVID. So from the first day of influenza-like symptom or common cold-like symptom, patients will be isolated as COVID patient is isolated.
Thank you, sir. Sir, the next question, we get some new symptoms, like in original case to this new case, there is GI symptoms and fatigue and persistent cough.
Yes, yes.
Now, is there any difference in homeopathic approach in this new situation?
Yes. Regarding homeopathic approach, the approach is not something new. Whatever approach we taken earlier, that approach should be elaborated and enriched in the new situation. To any epidemic disease, a homeopathic physician's approach should be from two aspects. One is from preventive, another is from treatment aspect. In treatment aspect, there are 3 types of patients generally we are getting. Fresh cases, a group of patients not under treatment of any doctor or any therapy, they may come to your clinic or at our chamber. Another group of patients, they have been treatment either allopathy or homeopathy. But one thing is very important, patients, those who are taking medicine on their own, that is self-medication, it may be homeopathy, it may be allopathy. When they come to allopathic physician or homeopathic physician, the case becomes somehow or other too some complicated. Another group of people, they are coming to homeopathic chamber after recovery, so-called recovery from COVID, that is post-COVID syndrome. But the prevention part is very important for any epidemic disease. And in homeopathic approach to the second wave preventive part, we should consider the genus epidemic of sequencing. In early phase, during 2020 March, when the COVID-19 started in our country especially, we are having paucity of symptoms. We have collected all the symptoms from different countries, and considering all those symptoms, we have selected a medicine, and the government of Ayush Ministry, they have advised, they have published advisory, accordingly we have prescribed. For last 2 and 3 months, before January 2021, almost there was no occurrence, very little infection was getting. But since February 2021, suddenly it goes up and goes to the peak, started from Maharashtra and from different, almost 10 to 12 states are involved. Whenever we are getting symptoms and we are treating patients, we are having enormous scope to select the genus epidemicus. As far our knowledge is concerned, for last 2 months, whatever patients we are treating, you may also share your opinion. Out of 10 patients, during course of treatment, either in initial phase or middle phase or last phase, out of 10, almost 7 or 8 patients require bryonia. We know well from the knowledge of organon of medicine, during epidemic diseases, the particular medicine which is favorable or selected for most of the cases and the effect shows very good, that medicine would be considered as the genus epidemicus. Considering that, on 25th and 26th April, accumulating all the knowledge for last 2 months and the homeopathic source literature, we have published a BAA protocol, preventive protocol for this genus epidemicus. Someone may not agree with this protocol, but we are not having a point of contradiction to that people. You may go on your way and on your knowledge, depending on your knowledge on that thing. But whatever work we did, depending upon that, we issued a BAA protocol, that is genus epidemicus. How it will act and how it will be presented or administered, I will say later on. First, genus epidemicus. Second is constitutional treatment covering the miasmatic background. The patient, known patient, those who are under our treatment, those patients should be properly covered with constitutional anti-miasmatic drug. Apart from that, open air exercise, a nutritious diet, last and foremost, though it is last, but it is foremost and it is essential, is the COVID behavior. Mask, social distancing, and sanitization. It is a must. Now I am saying another thing I would like to share. During last about 1 year, what I have observed in my clinic during the COVID period for last 1 year and 1 month, patients, those who are under anti-miasmatic constitutional medicine, hardly they suffered from COVID. Even during the last phase, during the original one when COVID was started, very few patients got attack of COVID. Even last 2 months, I observed those who are under anti-miasmatic homeopathic constitutional treatment, hardly they are suffering from COVID. If anyone suffer and their complication is very poor, or other complication is very rare. Now I am like to share the screen with you people regarding COVID protocol. It is BAA Protocol 2021. In this name, we have published the protocol in different social media, and then also we have the letter has been sent to our ministry. For BAA Protocol, we have selected the medicine as a genus epidemicus Bryonia 200, 2 globules with 4 TSF of water in empty stomach for adult. For children up to 12 years, Bryonia 200, 1 globules. In both the cases, the globules number preferably it be 15 or 20, not more than that. 4 doses to be required for every phase. On first day, that is first dose. On second day, second dose, 24 hours after first dose. On fourth day, third dose, that is 48 hours after second dose. On seventh day, fourth dose, there is 72 hours after third dose. And same procedure to be repeated after 28 days after the completion of fourth dose. The BAA protocol, which we have published, and those who are agreeing with our protocol, they may conduct this work on their own. And I am requesting all of you, we have also sent a Google format for survey. Whoever going or adapting BAA Protocol 2021, please submit your form, prescribed form, whatever we have sent to you.
Thank you, sir. Sir, you told about the Bryonia. What are the other commonly selected medicine and its efficacy?
It's a very good question you have asked. Actually, the other medicine which were requiring during last 2 months, most of the medicine which has been effective. And for that reason also, I am like to share a beautiful repertorial chart before you. comprising the common symptom, we have repertorized. We just see the repertory, what medicine actually coming. Whenever we put it the common symptom, what we are getting in the new second wave, and consisting all those symptoms from different repertory, you have repertorized. The medicine came: Pulsatilla, Nux vomica, Netramure, Arsenic, Sepia, Sulfur, Calcarea car, Bipica, Carnica, Bryonia, Phosphorus, Rastox. If you see the repertorial chart, Bryonia is go backward rather than Pulsatilla is coming forward with numerical aggregate. But during clinical practice, what we have observed, the Bryonia acted very beautifully in most of the patients. But during course of the treatment, they require Pulsatilla, they require arsenic, they require sulfur, they require phosphorus, they require Rastox, Carbophage, and many other medicines. Regarding that, I do like to also say another group of medicine which is very much effective during last phase or during the recent phase of COVID-19. Another group of medicine is Hipersalt. Another medicine is almost I already told, sulfur. Nojors is very much effective if we consider tuberculinum, sorinum, and another medicine during complicated stage, Calicog and Thuja acted very good.
Thank you, sir. Sir, another question, a very common. The people's or patients came to us after some self-medications. Either it is allopathic or sometimes it is homeopathic. What will be our approach, our homeopathic approach after those patients who came after self-medications? Thank you.
After self-medication, whether they took allopathic medicine or homeopathic medicine, it matters little actually. We should consider the presenting acute totality for every case. We should consider. No other way or shortcut is required for that. We should go for acute totality. Whatever symptom they are presenting with their illness, that should be considered. For that reason, in selected cases, the patient, those who took some allopathic medicine, even some homeopathic medicine that not improved properly, in selected cases, Nux vomica acted very beautifully and it cleared up the case. And after Nux vomica, the original indicated medicine came.
Thank you, sir. Sir, another question. Once upon a time, a patient came to my chamber. He told that, doctor, I don't have any COVID. I have smell, I have taste, but I am very prostrated. The weakness I never felt. What will be our approach in those asymptomatic but very prostrated COVID positive cases?
Actually, we are considering those patients apparently asymptomatic. Patient who is very much prostrated without any so-called COVID common symptom, the prostration is a very good indication for consideration of or selection of any medicine. In those cases, I am suggesting you people to take the case in detail. And mostly what happens, not only in asymptomatic cases, in post-COVID cases also we are getting prostrated patients. In those cases, actually what happens, on the layer of the miasm, the acute infection took place, and making a combination, some patient may manifest very good symptoms on periphery, and some patient may not manifest. So, in most of the cases, those who are suffering from prostration and weakness, don't go for any mother tincture or any other supplementary therapy. First, consider the patient as a whole, make a totality, and apart from that, keep in mind about the nutritional status of the patient, what food actually he is taking. And most of the cases, those who are suffering from prostrated, or those who are getting prostration, they may have some trouble in taste. They may not take properly food. Intake is very poor. For that reason, whenever we are selecting any medicine according to totality, it may be sorinum, it may be tuberculinum, it may be pulsatilla, it may be bryonia even. After getting that medicine, the taste returns and the patient improves very rapidly.
Thank you, sir. Another very common thing, after vaccination of the COVID-19, in some cases, what I had seen that sometimes patients are very prostrated, sometimes their hypertension, their pressure will high, sometimes diabetes shoot up. How we can tackle those post-vaccination syndromes?
Very good question. Actually, till date, the modern medicine person, they did not declare post-vaccination syndrome, but we are getting lots of patients in our daily practice. Statistically, vaccination adverse effect is very insignificant. The number is very poor, but those who are suffering, they are suffering. So considering the adverse effect of vaccination, rather post-vaccination syndrome, if we classify it, that would be better for our selection of remedy. Regarding vaccination adverse effect, the effect should be generally classified in broad two aspects, recent effect and remote effect. In recent effect, we are getting two parts. Local effect on the part or affected point where the vaccination took place, some symptoms appear there, and the systemic effect in recent. And the remote effect, the systemic effect, apart from that, patient those who are suffering from any chronic disease, that explosion of latent miasmatic state come forward. Actually, what actually we are telling, patient those who are suffering from blood sugar or diabetes, otherwise sugar was controlled. Patient those who are hypertensive, the blood pressure was under control with treatment, but getting vaccination after 15 days or after 1 month, completing the second dose, the blood sugar puts up, the hypertension is uncontrolled. It is the explosion of latent miasmatic state we are getting. Mild side effect of co-vaccine, whatever we are getting in the fact sheet, include injection site pain, that is a local trouble, site swelling, that is a local recent trouble, injection site redness, injection site itching, stiffness in upper arm, weakness in the injection arm, body ache. But the systemic effect we are getting is the body ache, headache, fever, malaise, weakness, vomiting. And the company said that there is a slim chance the vaccine causes a severe allergic reaction. Yes, I am putting before you the original fact sheet from Covaxin company, what they have published. Signs of a severe adverse event include difficulty in breathing, swelling of face and throat, first heartbeat, rashes all over the body, and dizziness and weakness may come. Some of the very common side effects of Covishield, as per their fact sheet, are tenderness, pain, warmth, redness, itching, swelling, or brushing while the injection is given. That is the local effect. Generally feeling unwell, chills, or feeling feverish, headache, and joint pain is a systemic effect. Especially getting Covishield, the systemic effect included headache, fatigue, chills, shivering, diarrhea, fever, arthalgia, myalgia, and nausea. All of the recent systemic effect and recent local effect we are getting in the fact sheet of different vaccines. 1 in 4 people experience mild, short-lived systemic side effect after receiving the COVID-19 preventive by Oxford AstraZeneca. Those with a confined case of prior COVID-19 number are almost twice more likely to have side effects that affect the whole body after the first dose of the Oxford vaccine. Participants who had a confirmed case of prior COVID-19 are 3 times more likely to have side effects that affect the whole body after receiving the dose of the Pfizer vaccine than those without known infection. It has been published in Lancet. The researchers noted that phase 3 clinical trial of the Pfizer vaccine, the most common side effects were pain in the injection site, fatigue, headache. However, the real-world analysis found less than 30% user complaint of injection site pain, that is the local side effect, and less than 10% is fatigue. And the AstraZeneca vaccine systemic side effects are found in 88% of younger participants in the age group of 18 to 55 years after the first dose. But the study found a significantly lower rate of side effect, that is 46.2 after the second dose. If we go through the repertory for the adverse effect of vaccination, we are having list of drugs in our repertory and in our mathematics also. For that perspective, I am suggesting few medicine you may include on your part if you have, or if you having any idea. Whatever I am using in my practice, I am suggesting you people. Local and recent effects may be controlled by Apis mellifica, antimatter, sulfur, mercury, silesia, vaccininum, and thuja. But systemic effects, considering the phenomena, that is, vaccination, he or she took vaccination, and what manifestation takes place in the system. In most of the cases, thuja is a very good medicine. And flare-up of chronic disease, if be unbearable, draw the totality of acute exacerbation and prescribe accordingly. Patient, those who are chronic sufferers, those who are suffering from chronic disease, otherwise they are good. But after taking vaccination, if they are complaining of unbearable trouble, the old trouble became exaggerated or exacerbation. In those cases, we have to draw a fresh acute totality, and accordingly we have to prescribe. If the old symptom aggravates, at least we should wait for a few days. If it subsides, then no question of medicine would be given, that is placebo. But if persists, consider the case and prescribe accordingly. But to prescribe thuja as a block remover when getting vaccination, the conventional medicine do not act favorably. In almost in every case, thuja will do a havoc. Now I am telling a few indications, that is the phenomenology of vaccination effect. In antimatter, we are getting different books, mathematical books. Antimatter is a very good medicine for adverse effect of vaccination when thuja and silesia is not indicated. So, whenever we like to prescribe antimatter, we should know the symptom or after effects of vaccination, what we are in silesia or what we are getting in thuja. In silesia, suppuration of the affected part, neurological symptom after ill effects of vaccination. And in thuja, already I have told, lots of symptoms are getting. Actually, antimatter, whenever after vaccination, skin pustules are there, and along with some systemic effect, nausea, vomiting, everything, the loss of appetite, everything takes place. Antimatter is a very good medicine for prescription. Never well seems vaccination, especially neuralgia and troubles in different parts of the body or viscera. Already I have told this thuja. Apis mellifica is a very beautiful medicine for bad effects of vaccination. The important finding we are getting in Apis mellifica, less appetite at night, but good at daytime. The beautiful characteristic symptom, if we get it after getting vaccination, if anyone is complaining, I have lost my appetite, I hardly took any food at night, but I can take it and day. In those cases, if abscess takes place at the site of vaccination, the Apis mellifica will be more indicated. Another medicine we may think for adverse effect of vaccination, that is the eye trouble, especially keratitis, a splitting pain in forehead, and in selected cases, kidney troubles may develop. The medicine is vaccininum. The dreadful effects of vaccination and flares of a miasmatic symptom. To cover up this, sulfur would be a very good remedy. Even if we go through Hahnemann's lesser rating, we will get it. Hahnemann advised, not only advised, he wrote a letter to his disciples during a smallpox vaccination. If any patient is getting trouble after taking the smallpox vaccination, patient, those who are complaining of skin rash, those who are complaining of pustules, sulfur, how beautifully acted. Not only that, if we go through Clutch Dictionary of Mathematica, in sulfur chapter, in introduction part, we will have beautiful information. That is, whenever the smallpox vaccination was continuing, during that period, a group of people they are working in a sulfur mine, and in those cases, the vaccine did not work properly. So sulfur having a very significant relationship with vaccination. So regarding adverse effect of vaccination, when the old miasmatic disease, chronic disease flare up, in those cases we may think of sulfur if totality corresponds. Post-vaccination eruption continues, especially hemorrhagic manifestation. Proteolus is a very good medicine. Regarding silesia, another important point we do like to remember, we do like to keep in mind, that is low food and nausea after vaccination. A patient having a lethargy, rather loathing of taking food with nausea after vaccination. Arnica is a very good medicine. Hardly we are considering Arnica for side effects of vaccination. Simply eases the discomfort after vaccination. Not significant or not defined discomfort. Patient in general feeling discomfort and not recover from that. In those cases, if the patient is complaining of soreness all over the body, Arnica will act beautiful.
Thank you, sir.
Okay.
Thank you, sir. Another question, very common thing. In case of COVID-19, we all know that 4 or 5 days, maximum 7 days, the oxygen level, saturation of the oxygen will low. What will be the homeopathic approach in those cases?
Nothing new approach actually. The thing should be taken under consideration whenever we are treating any COVID case. The parameter from investigation part of point, from pulse oximeter, everything, we should be very much cautious about all those parameters. First of all, we should consider have to advise the patient to monitor themselves regarding their oxygen saturation. Some patients may not have the facility for measuring oxygen saturation. For those cases, we may ask them whenever the patient is talking or making conversation with other people, hardly they continue their conversation for more than 1 minute. If it be happen, in those cases also, actually they are suffering from low level of oxygen saturation. So, regarding all those situations, the important thing is patient, despite of taking proper medicine, if the oxygen saturation falls, in those cases, oxygen support is very important. But what I observe in my clinical practice, if we prescribe medicine, getting the peculiar totality and peculiar characteristic symptom, I am having 2 beautiful observations regarding oxygen saturation. One patient, she was discharged or rather discharged from hospital with a 92 and 94 like saturation, and where she was being at home, and within 3 to 4 days oxygen saturation dropped down. They consulted me, and getting all the symptoms, the medicine came Pulsatilla. The saturation was within 88, 89 like that, and she was under oxygen support. And I suggested them, I am giving medicine, but within 1 or 2 hours, if oxygen saturation is not sufficient enough, please admit her at hospital. But surprisingly, after getting Pulsatilla, the patient who hardly making conversation with the family members and hardly talk with me, they reported me at about 7 p.m., 7 or 7:30 p.m. they started, but they are administered Pulsatilla 30, and when she was compelled to take rest, not move, and at about 9:30 p.m. at night, she took her dinner, and throughout the night, she experienced a very beautiful sleep without any oxygen. And day after tomorrow, she reported me. And another patient, one of my homeopathic friend colleague, just day before yesterday, he reported me, and the oxygen saturation is fluctuating within 92, 93, and 94. Considering his presenting symptoms, I prescribed Carbovez 30, 2 dose, fractional dose, and getting 2 dose Carbovez 30. Today morning, he reported me. He is doing well and his oxygen saturation is 97. Why I am giving the example, if we select a medicine according to the presenting acute totality and characteristic symptoms. If the symptom correspond, it will help the medicine patient very good, and it will help a lot. But if symptoms do not correspond, just giving any medicine, homeopathic medicine in lower potency, considering that medicine may help in bronchial asthma, so it may help in oxygen saturation. That medicine may help in cardiac asthma, so it may help in oxygen saturation. Likewise, in this manner, if we prescribe, rather we will cause harm to the patient, rather to make good. So I am requesting all of you, considering the acute presenting totality, prescribe homeopathic medicine and ask the patient to monitor properly, especially 6 minutes working monitoring is very important. If the patient having the facility of measuring oxygen saturation at their home, ask them before moving, when he or she is taking rest, first observe the oxygen saturation. After that, slowly move in the room for 6 minutes, and after moving for 6 minutes, if the oxygen saturation falls below 92, the patient should be admitted to the hospital for oxygen support, or if possible, oxygen available in their home by any technical person or under the supervision of any doctor or nurses, that may be afforded.
Thank you, sir. The problem is oxygen is not available.
Yes, yes, I know.
Sir, one rumor or it is information I don't know in Facebook and everything. Aspergers Pharma, about the Aspergers Pharma will increase the oxygen saturation. In my experience, I had used it in my chamber successfully in case of exertion dyspnea, especially in cardiac asthma.
Yes, yes.
In case of COVID-19 low oxygen saturation, in your opinion, will Aspergers Pharma work or not?
No. Actually, regarding Aspergers Pharma, there is a viral video and viral WhatsApp message and social media we are getting for last 2 to 3 days. And I would like to salute the Haryana Government Homeopathy Council. They have published a notice against it. This should not be. For general public, without knowing the effect of the medicine, they are rushing to the homeopathic medicine shop and getting Aspergers Pharma bottle and bottle to improve oxygen saturation. As far my knowledge is concerned, Aspergers Pharma is a very good medicine for cardiac asthma, but for acute palliative relief, and getting Aspergers Pharma, no way it is substitute for oxygen. Patients those are having low oxygen saturation, drop of Aspergers Pharma will not give the substitute service for oxygen therapy.
Thank you, sir. One, sir, last questions. You told about all the scopes of the homeopathy in case of COVID-19. Now, what are the limitations of homeopathic treatment in case of COVID-19?
That's a very beautiful question. We should know. Whenever we are telling about scope, we should know about the limitations also. Actually, what is happening, we are having scope in that part when our allopathic friends, from World Health Organization to all organizations, different medical societies, they clearly declared they are not having any anti-COVID treatment, rather antiviral treatment for this situation. This is the main scope in homeopathy. Why I am telling, whatever may be the virus, whatever may be the strain, whenever we are treating any patient, we are considering the manifestation. So, in first strain, in second strain, in third strain, even in influenza, even in H1N1, even in COVID-19, we have to collect the accurate manifestation. Regarding that, Hahnemann beautifully told. Hahnemann told about epidemic disease. The physician should have discriminate the symptom. Discriminating observation. The term is used in writing what he wrote. Actually, unless until patient or doctors having discriminating observation, hardly they can select the medicine. So through discriminating observation and the knowledge of Materia Medica, we may serve the people in all stages. But what is the main thing? the limitations we should keep in mind. Despite of all effort, depending upon the constitution of the patient, the innate immunity of the patient, despite all effort and selecting proper homeopathic medicine, sometimes some patient may not improve. But it is very unfortunate for us. We are not having any homeopathic state government or central government sponsored hospital, COVID hospital, where the facilities are available. When the patient life is in danger, the oxygen support is required, or any other mechanical support, PAP bypass ventilation is to be required. In those cases, we are handicapped actually. So that is the main limitations we are having. Whenever we are treating any patients, if the patient in any point, the homeopathic medicine, whatever we are prescribing according to accurate totality, discriminating of doctor, discriminating observation, it may happen in selected cases, the medicine will not act, depending upon the vitality of the patient, depending upon the reactive power of the patient. And in those cases especially, the supportive treatment is very important. So there is a limitations we should keep in our mind. And for the limitations, the parameter that should be followed properly. Whenever the patient, we are treating a patient with COVID patient and giving bryonia, rastos, phosphorus, even tuberculinum, but we are not considering the condition of the case. After 3 to 4 days, if the persisting annoying cough is going on, temperature is high, we should at least go for CRP and TCDC and ASI, along with a simple chest X-ray, plain chest X-ray. And if we get all those investigation reports, then we can assess the prognostic value after getting our medicine, what improvement is taking place. And if requires any supportive therapy, we may, in advance, we may appreciate or we may suggest the patient, your lung condition is not good, such and such. And even if we get the HRCT scan, if it is available for the patient is having the facility for that, we may also suggest for HRCT lung to assess the clinical condition. It is a limitation in our part. In selected cases, we are having shallow knowledge. We are considering ourselves, we may cure every case of every disease in every stage. But the pathological state, the pathology of the disease should be considered, and accordingly, we took the decision what medicine will be effective in this stage, along with what supportive arrangement should be done for the particular patient, for the particular situation. So the limitations we are having only if we have state-sponsored or central government homeopathic COVID hospital in every state. We are getting state government run homeopathic medical college. In our state, we are very fortunate. There are 4 state government run homeopathic medical college and 1 central government run homeopathic college, but there is no provision for life support for COVID patient. Rather, in a few 7 days ago, in our state, all homeopathic hospitals, indoor department, even in Ayurvedic hospitals, indoor department, they are compelled to offer to government of West Bengal, as the paucity of bed is there, vacancy of bed is very trouble, patient is in trouble, to offer a dedicate that space for COVID patient, but not with homeopathic treatment, but with modern medicine, so-called modern medicine help. So we are that limitations we are having. But one thing I am telling, I am sharing you, the important thing, if you prescribe the medicine considering the discriminating acute totality from the first stage of the disease, hardly the patient will complicate and go for the limitation part. Another thing, whatever chronic patients you are treating, don't give more than one medicine at a time. Don't give along with a potentized medicine, other mother tincture or supportive palliative drugs. If we do not give all those medicine, if we prescribe according to Hahnemannian principles for miasmatic and constitutional treatment, then those patients will be in a safe position. And if they suffer, hardly they are suffering from COVID, what I am observing, But even you are getting infection, in those cases, hardly they will go for complication. So our scope is enormous regarding the different of strain of virus, differing the name of the virus. We are having no limitations, but we are having limitations regarding infrastructure, regarding facility. We are not having. For that reason, to maintain the fame and name of homeopathic mode of therapy, we should be very cautious about the prognosis, about the pathological state of every patient whenever we are treating, regarding oxygen saturation, regarding lung picture, regarding blood picture. We are prescribing homeopathic medicine and we are not observing the CRP. Patient is complaining, I am feeling almost similar, but my cough is somehow or other improved, but temperature is somehow or other improved. I am very much frustrated. But we did not advise any CRP or any chest X-ray. Actually, what happened? Patient COVID pneumonia started, and getting COVID pneumonia started, patient is in happy hypoxia. So subjectively, he is not feeling so much of dyspnea, but the oxygen saturation fall down, and the oxygen in the brain is also going less. And as oxygen is going less in the brain, patient is hardly subjectively observed is the particular difficulty what he or she has.
Thank you, sir. It's a long-awaited discussion for me, and I think all of our BAA member will benefit from this discussion. If anyone have any question, you can ask, sir, about your. Hello. If anyone have any question,
Hello.
you can ask.
Hello.
No, it is write down in your chat box, please.
Write down in your chat box.
Before that, Jayanto, let me share a few prescribing symptoms of medicines, common medicine, what is recurring in our daily practice for new strain and old strain. That could be better. Whether is there any question in chat box? No, there is actually no question.
No question, sir.
Okay. Now let us discuss in a very brief point regarding a few characteristics, symptoms, that is discriminating symptom we are getting and commonly used medicine. One thing is very important for a COVID patient, not only in COVID patient, for any epidemic disease, patient with epidemic disease and suffering with fever. Both the chill, heat and sweat state should be considered and observed very accurately. And regarding the medicine Naxomica, I am telling a few symptoms. So Naxomica, the prodromal symptom will be some gastric trouble. And along with gastric trouble, Naxomica patient, they have having anticipating morning fever and long-lasting heat with thirst. Naxomica, long-lasting heat with thirst, along with the peculiar symptom we are getting in Naxomica patient, the painfulness of the skin, like arnica, soreness, painfulness of the skin. During heat stage, Naxomica patient is thirsty, but during sweat stage, without thirst. And sweating relieves the limb of the pain on the limbs. Another important point is during apyrexia, when the fever is not high, the leg feels weak with a paralytic weakness of the limbs. In Naxomica we are getting too weak to move and chilly from least motion. One thing is very important regarding chilliness of Naxomica. Whenever Naxomica patient is in the open air, it causing more chilliness. But in room, whenever the fan is moving, patient feeling good. A chill more in room and less in open air, the opposite symptom we are getting in nostrils. We all know regarding the arsenic album prostration, but one thing is very important for arsenic album: sleepiness. Sleepiness and prostration, yawning and stretching, and restless night before the paroxysm. Patient will tell, I feel very much restless a day before yesterday or just yesterday night after getting the symptom. But one symptom is very important for arsenic patient, that is the anxiety. No anxiety, no arsenic. Whatever may be the complaint during COVID or any other symptom, in almost all cases, the arsenic patient, they are complaining of anxiety, fear of death and all the symptoms they are getting in arsenic. Another medicine I do like to share, that is the bryonia. Already you have told in detail. The bryonia symptom, we know all the symptoms from different medica. One thing is very important for bryonia, bitter taste in mouth in all stages. But in arsenic, patient is also complaining of bitter taste in mouth, but especially while eating or after while eating. Dry racking cough with pain chest is bryonia. Dry racking cough, annoying cough without pain chest, it is Rostock's. Along with all symptoms, some peculiar uncommon symptom I am sharing you for selection of medicine. Regarding mental attitude, bryonia patients, they are very much apprehensive and fearful. The one thing is very important regarding mental modification of bryonia patient, that is talks about business and fear of poverty. Even the patient, those who are requiring bryonia during acute phase of COVID treatment, during post-COVID period, in selected cases, selected patients, they are complaining the same mental depression and mental disposition regarding fear of poverty. In those cases, considering the totality, if we have Suriname, a good, very good result we are getting.
Sir, one participant's question, that is there any medicine useful in case of COVID pneumonia? When COVID pneumonia sets in, is there any medicine useful? Is there any homeopathic useful medicine?
What is the question?
So, when the COVID-19 pneumonia sets in.
Yes. We are having medicine. During COVID pneumonia, when the COVID pneumonia is continuing, depending upon the presenting symptom, antimatter, phosphorus, and the beautiful medicine is Hipersol and Palsitida. And in selected cases where the pneumonia is more severe and grave, phosphorus, calicar, and those medicine will act very good. In selected cases, Thuza may also cover in some patients. Especially, we should consider antimatter, phosphorus, carbovage, pulsatilla, and in complicated cases, during pneumonia, we may have prescribed tuberculin also.
Okay. Sir, one of the participant question, you told about the doses and potency of bryonia in cases of COVID-19 cases, but what are the doses and potency when Naxbom is selected?
Okay, actually I have told bryonia 200 for preventive, not for a curative purpose. But regarding curative purpose also, what I observed, bryonia 200 acts better than bryonia 30. But in case of Naxvomica, in COVID cases, Naxvomica 30 acts very beautifully. COVID Naxvomica 30, in frequent dose, we have to repeat it. Actually, what is happening, in new strain, the patient is rather more complicated and grave. That is why first day, Naxvomica may require. So throughout the day, 3 to 4 doses may require. After one day, what happened? The patient may not have any Naxvomica symptom. On the next day, patient is complaining the symptom, and considering the acute totality, it may be pulsatilla, or it may be arsenic, it may be bryonia. And in those cases, in bryonia 200, actually I am prescribing twice daily, and whenever we are giving 30, in selected cases, in pulsatilla 32 doses, fractional dose. After getting the medicine, no need of medicine for 2 or 3 days. It is also happened. It is also happened.
Sir, another question from participants. Though it is less, but in case of COVID-19 conjunctivitis, is any medicine or medicines are indicated?
No, actually, to only considering the conjunctivitis or medicine prescription is not be very good, but the peculiar characteristics eye symptom you may consider, and considering that you may prescribe. But in selected cases with conjunctivitis and COVID symptom, early COVID symptom, argentum niticum acted beautifully. But apart from that, Bryonia itself, Pulsatilla itself work beautifully along with conjunctivitis.
Any participants have any question, please write down on chat box. So no question.
Also, from the very beginning to end, the things should be keep in mind for every homeopathic physician. That is what Hahnemann told or advised. That is the discriminating observation we have to do. And after getting the observation, whatever symptom we are getting or collecting, if you do not know the symptom in correspondence mathematica, just go through repertory, search in repertory, you will get the medicine. And what is actually happening, almost it is happening in almost in every epidemic. The lots of good number of medicines are not coming for any epidemic disease. For any acute stage, considering the different stage, 4, 5 to 6 medicine may come, and within that medicine, almost 80 to 90% patient may recover. And one thing is very important: the total COVID patient, if it be 100, among them 85% patient will not require any support or infrastructure. Those cases may safely be treated with homeopathic medicine, but with proper indication we have to treat them. Only 10% patient they require hospital support, or only 5% patient they require extraordinary mechanical support, ventilation and all those things. So for COVID patient, be confident enough, but don't having any zero confidence. Be confident enough with your homeopathic knowledge, mathematical knowledge. At the same time, be very cautious about the pathological state of the patient and clinical state of the patient. And considering all, prescribe homeopathic medicine, it will act very good.
Sir, one participant's question. Please once brief the Bryonia 200 doses.
Will Bryonia 200 be given after 2 subsequent doses after 20 days again for third time? Yes, if the situation is continuing like that, whatever it is continuing, at least we should continue for 3 successive months Bryonia. If drop down drastically, then we should think for at least for successive 2 months we have to prescribe as per BAA COVID protocol what we have advised.
Okay, thank you, sir. Any question, please? Sir, no question from the audience.
Okay.
So we can conclude. Thank you, sir.
It's a pleasure for me. It's a pleasure for me. Dr. Jayanta Dhar beautifully moderated our today's session. And whatever participants they have joined this today's session, I do like to congratulate all of them and wishing all of them good health, be safe, stay healthy, and do for mankind. But one thing is very important, what Hahnemann told. Actually, if you will not be healthy in your healthy status, you will not belonging, then how you will help the patient? So, do practice, but maintain all COVID behavior as a physician, take nutritious diet, and also take rest, and do open air physical exercise every day. For every homeopathic physician, I am requesting all of you, do physical exercise, take nutritious diet, take moderate rest, and do homeopathy, correct homeopathy, Hahnemannian homeopathy for the mankind.
Thank you, sir. On behalf of participants, sir,